Good morning. Let's get the Legislative Health Chair on the line, Senator Therese Terlaje. Good morning, Senator.
Morning, Chris. Good morning, Sabrina.
Good morning.
Good morning, everyone.
So we just had Linda Pingo Denorsi on the line, unpacking what she said. Were you satisfied with a lot of the answers we got?
Of course, if I agree with you. If you can get Linda to take the time to talk, she's so thorough, she's so professional, and I really appreciate that she was able to dedicate that time to explain so many things that the community has been asking. So I'm very thankful for you doing that interview and for her. You know, Linda has been designated the Public Health Authority, and, you know, we have a statute that gives this Public Health Authority great powers during an emergency, especially a pandemic emergency. So she's really the authority that,
the czar, the public health czar.
In so many things, yes.
Czar.
And so, but she has been working on these things for months now. Now that it's, you know, we're getting to the end of March, it's been months now that she's been really working so very hard. So I just want to tell her thank you, and her team. She's got an excellent team behind her at Public Health, and even in the other agencies that she's partnered with. So I want to thank all of them.
And she's really actually been with Public Health for a very long time. And I know when they made the announcement that she was going to be the director of Public Health, it was so good to hear because, you know, I trust Linda.
Right.
Yeah.
So,
Not some like political hack.
right. She knows what she's doing.
She led our community health centers. She built those things up and really got, you know, federal funding for them and has made them, you know, become accredited. She's really been excellent. So it was an excellent choice for her to become the director. I agree.
Senator, so you were satisfied with the answers, you know, just kind of overseeing health. What do you make of the governor's executive order yesterday that came out? And maybe if you had any specific comments about the CURE team. This is the COVID Unified Response Effort.
Right.
Yes.
And it's a 3-tier system. But go ahead, Linda.
Okay,
go ahead, Senator.
Sure. The executive order, I first want to say I completely agree with the governor when it comes to extending the time where only essential operations should be going to work and that everyone else should be staying home. I think that's very critical. It can't be overstressed, so I'm glad to see that we're getting, you know, doctors, everybody coming out, and then you're seeing it on social media too, that people, they get that. So we just, you know, so extending that, I completely agree with. I think it's a great idea, and it's necessary. It's critical, actually, at this point, because, as you know, and you've been reporting this too, we're very limited on Guam with testing. So if we can't test our community, we have to act as if they're all, you know, got the virus, because we can't tell who does. And so that's kind of why, you know, we locked it down. And so that's like us. You know, ideally we test everyone, but because we're limited in that capacity at this point, then that's our second, you know, most important thing that we can do. All right, and then the other things in the executive order, closure of the parks and the beaches. I agree with all of those things. I think we may need to take a look, you know, a little bit more at what is being deemed essential, and just ensure that those really are, or narrow them down, because they're kind of, some of them are broad categories. But,
Right.
But otherwise, yeah, the creation of the CURE, you know, it's good. I think, you know, the governor explained to us, you know, who's on this team, not their name, but kind of like one comes from this facility, that, you know, that hospital, these other clinics. So I think that's good, and it's good that they're getting medical advice directly, and we're just going to have to wait and see on that, I guess. We want, you know, everything to be driven by medical. I think coordinating, this is a lot of the stuff that Linda tried to prepare for by trying to assess what the different clinics had in regards to supplies, equipment, capacity, what types of doctors, what type of skills of the nurses. They've done all of these types of surveys island-wide to try to, you know, better coordinate what we're going to need in this huge emergency. And so I'm glad that the doctors are also, you know, teaming up to do the same. And so consolidation of these efforts, I agree with that. That we should prioritize, what's going to happen at GMH and GRMC, and I guess the only part that's hard is it seems to shift, right? So from the meetings that I've been in prior to, our first case being confirmed, clearly things have shifted from those plans and to, how we're going to implement this. But sometimes they're understandable shifts because, like I said before, I think they open the door and then there's some other obstacle there and that they didn't count on. And,
right.
And so they just have to shift as fast
The
as
term,
they can.
Senator, is rapidly evolving.
Exactly.
Right,
exactly.
yeah, that's the catch-all.
Yes, and there's serious things. For example, I'm hoping, see, one of the I don't know how much detail you want me to get into, but one of the things that for me I'm very concerned with that keeps shifting is this, what's actually going to happen at GMH versus SNU, versus home, right? And so the logic, I think, always was that SNU was going to be when we knew our hospitals were at, very close to capacity already with regular health care, that in this emergency, this pandemic, that we would exceed that capacity and we needed backup capacity. And so my understanding was that SNU was supposed to be that, and they were supposed to equip it to be able to provide services, hospital-like services that
right.
we just literally could not fit in the hospital.
Yes, that was our understanding too at the onset. I don't know how that's changed, and I don't know what factors led to that.
Well, I'm hoping that they still are pushing forward. They said they've got 20 beds. I don't think they're fully equipped yet as they had originally intended.
Right.
And so this is the thing, so that's the part that I think I'm just a little worried. I want them to finish that up, make sure the 20 beds are at least fully equipped, and that they move on to that 40 and that 60 capacity as soon as possible.
Right, and it's a 60-bed facility.
It's supposed to be, but it's clearly not at this point. And so I am worried about that. And
you heard from Linda, though, that they're also looking at a hotel to be used.
Those are for patients that do not need health care.
Low to mild symptoms or asymptomatic, right?
Do you know where this hotel is? Which hotel?
I think they did say the name, but I don't remember what it is right now. But the GHRA, by the way, is working very hard with the government of Guam right now. Mm-hmm. I think you had Mary on the other day, Mary Rhodes, and
right.
I think they continue to also be flexible and help to find lodging, not just for those who are being quarantined. I think the government's been finding lodging for some of these workers who will not be going home. They will be lodging, temporarily in another facility so they don't contaminate their families, things like that. For example, the SNU workers.
Right.
Especially when we fill those beds.
And, it was revealed that $4 million was going to be... Yeah, that was the estimated...
We didn't even get to this yet.
Yeah, and a couple of those are under your purview, right?
Right,
the judiciary?
so the judiciary, they take $1.1 million from the unified judiciary.
And just for clarification, the governor did say she's going to be seeking federal reimbursement for this.
Right, yeah.
Right. So, I can see it's tough to make a decision where you're going to get this money. I saw some of it comes from the judiciary, a big chunk from the judiciary, maybe over $1 million, and then
UOG.
Over $1 million from UOG,
right.
Correct. So, of course, we've got to do what
the Commission on Decolonization. I think they took it from all your agencies.
Perhaps. I'm not going to take that personal.
Right.
Yeah. Everybody's being very professional.
But they didn't take any from the office of the governor, I noticed. I don't know if you noticed that, but we did.
Well, this is another thing we have to work with. Obviously, we need to readjust 2020 budgets, right? And we have to make contingency plans for things that are not reimbursable or they don't get reimbursed, and that's going to have severe impacts on these 2020 budgets. And I think 2021 going forward, while we're trying to rebuild our economy, we are going to have to look at that very closely. So we're hoping to get information as soon as we can to continue work on those things. I know that everybody's been examining that very closely and trying to come up with predictions, but it's very hard to predict at this point.
Right.
I wanted to tell you that I also circulated a draft resolution to my colleagues for their consideration. I'm asking them to consider an amendment to our standing rules that will allow us to go into session, and for those who do not want to come into the facility to act remotely with technology. And I don't know the details of the technology. I'm hoping some of the RMIS guys can figure that out. But I want to get the consensus of my colleagues.
What are they saying, Senator? Because we had Senator Moylan on yesterday, and he was just basically like, "Yeah, we're not." They said they got to bend the rules or write the Bible over or something.
Well, I think we do. We have to. For example, I've been working with legal, and I was going to make an amendment in statute. They're recommending we make an amendment to our rules first, and so. I'm one of these people, Chris. I don't like to change the rules, right? I want the rules to be consistent throughout, but it's very obvious that coming into physical contact really is risky for a lot of my colleagues and all of us and our families. So if we can do this for this one epidemic,
right?
This one, and make sure that there are really truly emergency measures, that is not abused. In other words, then I just think it's looking more reasonable because of the time period that we've been shut down, right? And there's things I know that maybe everyone's thinking of things that need to be considered, but I do think we need to consider things like there's a bill that I introduced regarding just this quarantine. So according to our current statutes, the public health authority is able to quarantine people involuntarily and temporarily just on a directive for 10 days. And as you know, the CDC is recommending 14 days, right? So I'm trying to make it so she doesn't have to continue to go to court to get this extended.
Right.
Or those who are objecting, I want to give her the authority for my bill says 30 days. So it's changing from 10 to 30 days so that she can do that on her own without having to go to court. And because otherwise, look, we've got 200 people quarantined up there.
Are they covered, Senator?
Quite a lot.
I'm not a lawyer, but it kind of seems like they screwed up and they gave out the second form first, or I don't know who was responsible for it. But
no, I don't think so. I think they either way for me. I agree with Linda. They could try the voluntary first, but almost either way at this point, it's the same effect, because what they're saying is if you don't sign on the voluntary form, then
we're going to involuntary you.
No, that she has done that already, but
right.
That means, I think it means she may have to go to court and get it extended because she wants everybody to stay in there for 14 days.
Right.
In other words, she has the authority to keep you in for 10, but if you're not volunteering to stay in for 14 or whatever length of period she wants, then she may have to go to court. And I think to preclude that signing those voluntary forms are very helpful for her at this point, because it takes away any of the legal,
right. But people aren't signing them because, I mean, if you look at, I wouldn't sign it if I got slammed in quarantine for 14 days and they're like, sign this. I mean, I would, stay in quarantine because I know it's important to avoid the spread, but I definitely wouldn't sign nothing unless I call a lawyer.
And I think that for the most part, they understand that the people that are in quarantine, that they know, like, okay, we better just stay put. So
I'm just wondering if we're going to see like a $20 million lawsuit after all this.
I hope not. I just feel like if we can explain, this is a thing, everybody's scrambling, Chris, so understandably, I think ideally everybody knows, what exactly this voluntary versus involuntary form they're looking at, but we're not in an ideal situation at all. So I have to give credit to public health. They're actually scrambling as fast as they can to do these things without having the time to completely inform everyone. And I feel for those people up there because we need to get them more information. That's for sure. So we just have to also do that as a court. I think we're trying to prioritize things here, and health is first. So kind of it's like our lockdown measures; those come first,
right?
Because those are health and testing. And same thing with that. If we had a lot of tests, a lot of that quarantine wouldn't be necessary.
But what I'm wondering, Senator, is if when we do get the capability to just test, let's go test 200 people, if 50 of them come back positive, are we just going to send 50 people out there on home isolation. I mean, I kind of feel like that's what Dr. Cabrera was talking about with the health care system reaching a breaking point, is when we end up with an increased capacity to test people. We're just simply not prepared for an influx of COVID-19 positive patients. And that's why I think they're sounding the alarm.
Well, yes, we're not. So we want everyone to stay home because we have to stop it from spreading. Let's assume it's already out there in the community. We need to stop it where it is. This many. And right now we have positive people out there without symptoms, right? Because they're not in the hospital or seeking health care. So that's good because they're not having symptoms. They're not in need of health care right now.
But they're still contagious, so they got to stay home.
Correct, because we don't want it to go to those who will need health care, right? And because of their comorbidities or their other factors that put them at higher risk. We're just trying to keep that number down. But yeah, we're not going to, I think, the home isolation for those who test positive but have no symptoms, CDC is recommending that because we are trying to preserve the hospitals for those who need health care, right? Same thing with SNU. It looks like a luxury now to put them up there while it's it's not being used, but it's supposed to be for those with health care. So we just have to keep that capacity available, like split second. Yeah, things can change. We can have 20 with symptoms tomorrow, and it will be full. I mean, imagine that, right? It's very scary, how quick that can happen.
Senator, are you able to put on your tourism chair hat for a few minutes? And I mean, I feel like it's just too early to talk about all that stuff, but I know that they're probably already planning for the post-COVID-19 resurgence.
Well, GVB, they've been working hard on plans of, what are they going to do after this, after the, airports open up better, flights are more open, and so they call it a recovery plan, and they were successful before in doing these recoveries, and so they're very optimistic. But this, I think, Chris, that's really, in February they were tracking or predicting that March revenues for the TAF would be 50%, and going forward we should look at 50%. I think it's less than that now. I think I don't have the actual numbers. I'm hoping we can get those from the administration soon. But but just from what the people I'm talking to tell me, they're predicting 10% and maybe less going forward. So that's really dire. And the recovery plan, I think, is going to have to be drastic, right?
Yeah, it is.
Normally, some of the things that they use to recover require money, of course, right? We kind of subsidize flights, things like that, to get more tourists to come here. Yeah, and all of that, the marketers have had to stop and tell people that, we have quarantines in effect here.
Right, and I'm sure it's a worldwide problem, and I don't think, in monitoring the national, international media, I don't think we have an example yet of a place that has recovered from COVID-19 and has been able to stand itself back up. I don't think we have we?
Well, just pretty much those who've frozen in place, right? They're workers, and this is another thing. I think the letting go of workers is going to be a huge issue, because to get workers back, that's hard, and retrain them. They're saying they're going to send them to retraining programs. That's good, but we're still on lockdown, right?
Yeah.
Like you said, you guys are still on lockdown. In 10 days, I think it was, that we're into this mandatory isolation.
Day 10.
Right. So what's going on, though? I want to go back to what is the legislature doing? Are you guys meeting via Zoom?
They're in what? There's a chat group, right, Senator?
How are you?
Yeah, we do chat, emails, of course, and lots of phone calls, and
because we see bills are being introduced, and you just submitted a resolution, but
so I did a bill. I want to do a resolution. I want to, try to get a bill passed, that can temporarily put a moratorium on evictions. And right now, the courts have postponed all hearings and civil actions like that, but that goes right now until March 30th. So I'm expecting that they're going to extend that. I can't predict that. That's what I expect, that those will be extended. So there's a little bit of relief because you can't come in to evict anybody. However, yeah, I think the legislature, that we should act on a bill that will just
we tried to ask the governor.
A moratorium and for a few months at least until we can see for real whether the federal packages reach us, right? And then we can either extend it or do whatever we've got to do to match those federal packages. Some of these, you've got to do certain things before you can avail yourself of it.
Right. Yeah. I was a little frustrated when I asked the governor, what are we going to do for these displaced workers, hours cut, people losing their jobs, people trying to, scrape rent money together. And the response was basically hang in there. I think she said, please work with us. But they're just waiting for the federal assistance to come in. And there's just nothing. We're getting calls about, people who don't qualify for food stamps normally are now in a position where they need emergency food stamps. And I'm very glad that that's something that is a priority for Linda. But I don't think people can hang in there. I don't think they can wait for, Congress, the Democrats, Republicans to figure everything out there. You're right. But without you guys being in session, how can we pass laws about, eviction relief? And so I just want to go back to, you said you had made the ask, a draft resolution to your colleagues. What are they saying about having session? Is there a reluctance, Senator, or are they on board? Do they realize that people are asking, where are the senators?
I think, I haven't heard from everybody yet. So, but I do think a lot of it depends on the technology, right? And so we're hoping that they can come up with a technology that will allow it to the satisfaction of everyone. For example, I want a technology that allows all of us to be on at the same time and not necessarily just one at a time, because I feel like that that would be closer to how we conduct the sessions if all can be on at the same time. Things like that. But
we got our tech guy, Senator Jason here. I don't know. Is there an app that Zoom? Because
half a day, Senator. How are you? Thank you for joining us. Very good to be talking to you.
Or you can have.
We got a pretty good MIS team down there, and I'm hoping that they're going to be able to come up with something. But if not, I'm going to give them your number, Jason, for sure. Thanks.
Yeah, Jason. Maybe we get you an emergency contract.
You guys have had to convert. Yeah, I'm really amazed at how all the different businesses and have converted to electronic ways of conducting.
Yeah, I guess, Senator, I was always curious. Being in the technology field, I think the fact that that it's now being at least considered, if not fully implemented, that there are, let's say, ad hoc sessions or meetings between you and your colleagues in the legislature that are over different types of video chat platforms like Zoom, which is like the big word on everybody's lips right now because Adaloop is using that. I mean, all over the world, in fact, Zoom is like really taking off. Yeah. There are also platforms like Slack and like Google Classroom for the education sector. They're using that. I was always curious to see, like, is it in anywhere allowed in Guam statute that if sitting senators, and sitting is kind of the operative word, if they're not physically in the same space, can that still be considered like an acceptable session?
Basically,
you can have a virtual session.
There's nothing.
Never been to date. That's what. And,
right.
This is being considered by legislatures across the nation.
Of course.
And they haven't all agreed that they're going to go digital, virtual.
Right.
Because the other side of this whole equation is, of course, the public, right? And so that's what I'm saying. I'm one of the last people that says let's change the rules, but because the rules are intended to protect the public, to make sure the public can see, every second of what is transpiring in there, how these decisions are being made, and that's kind of the cost of what. Depending on what kind of technology we can hook into.
Right, but Senator, you guys have an Instagram, you guys have a YouTube. I don't know if there is a Facebook. So what I'm concerned about is we have had the speaker. I mean, I know she's writing letters and all that, but first it was like we're not going to have emergency session. Then it was like, oh, we're just postponing session until further notice with no clue about when you guys are gonna come together. So I want to hear from the rules chair. I mean, are we gonna try and change the rules, or are we just gonna continue to shelter in place? Let's be proactive about this.
I think Chris, yeah, I want to speak for all of my colleagues that I think they're all working very hard. They're all trying to do all the things I described to you this morning. We're all trying to get from our committees and hook those up with federal, make sure our, by statute that we are authorizing these people to hook up with any federal programs, and that we are covering the interims. And that we are trying now, I'm hoping everybody's on board to try and figure out a technology that puts us, able to physically act, just while we continue to isolate, from each other, something like that. And so I'm hoping this can be fleshed out very soon because
definitely, Senator. I mean, there are private sector workers out here who don't. I mean, I love my government and Guam employees, but they're getting paid. And you're right.
Yeah.
You and your colleagues need to step up and fill in the interim. And that's why I kind of had a problem with the governor telling everyone, "Hey, hang in there."
Well, yeah. The thing is, I mean, Chris, you have to admit things are changing every day too.
Right,
so even something I worked on, for a week, it's completely flipped, in a day.
Yeah,
and so those things keep changing too. But there are some good things that are happening. I feel like, for example, we've got the banks have put a hold on mortgages or collections on mortgages for residences. That's great, and I think if we can help landlords a little bit, that then putting a moratorium on evictions is going to definitely help the tenants. And when people call me and I tell them, right now, we've got a little bit of a reprieve, at least until March 30, and as long as the courts are closed, because they can't go through the eviction hearings, right? But I think if we can get something done in that time, that it would just be a temporary measure until, like I said, we match up either with the federal measures or just something more permanent.
Right. And so I guess, go ahead.
But one thing Linda didn't mention, and I want to make sure I don't forget to say this, is the public health has hooked up to, they're accepting almost all their applications for welfare benefits, new applications by email. So I'm sure email is still a challenge for some people, but it does open it up quite a bit. So if you can, get into email, then you can apply for those things from public health. And so I was very grateful that was expanded. They've expanded telemedicine, right? All the insurance companies agreed to this, and I think I told you this before, but I just think, every day they continue to have challenges, and the clinics and the pharmacies, they go to the insurance companies, and they've been, they've been responsive. So I want to say I'm grateful for all of these people for working together. It's a really difficult time, but you can really see they're trying to work together. They're trying to help the patients, and I'm grateful for that. And they're, without a bill being passed to mandate them to do this, they are voluntarily doing it. And so I'm very grateful for that. I think we still have challenges. The testing still a huge challenge. There's a challenge in getting things here. And that's what I spend a lot of my days is tracking down, when pharmacists call me and say, we need to get this medicine. Our suppliers in the States are only allowing us a restricted number, just like Linda's saying for the test kits. This is what's happening across the nation. And so, we just have to be as aggressive as possible to keep the stock, or get the stock that we don't even have any anymore, just to make sure that we can get those.
Yeah.
So it's working with all kinds of things, procurement. I mean, it's, these issues, but I think it requires diligence and faith, don't give up, because, and that's what I want to give credit. People who call me in the middle of the night or text me, their idea of how we could get around this or that. I appreciate that, because, I can follow up and it's working. I think we are getting around some things, and we are getting, longer refills, early refills. We're getting, things that are in very short supply. So I think we just need to keep up with that. We have to, the courts. I'm gonna call them today and see if they're going to be extending their March 30th, in line with the governor's recent proclamation. I expect they will do that. But and I want to give credit, because I know you had a discussion this morning regarding the homeless, but that one of the first things I looked at in the governor's I think it was her first executive order when she outlined what was essential. The shelters were definitely listed as essential, and I completely agree with that. They are essential, and these people are going to work in these shelters every day. And our shelters were always at maximum capacity. Always, this has been one of the biggest issues we've had, right? And finding alternate ways. And so, but I know that our community's really been stepping up and providing food, and I just want to thank these shelter workers for doing all that they have done, and for pretty much committing to do it for the duration of this and beyond.
All right. Thank you, Senator. We got to run, but appreciate your time this morning. You got some big committees, and we're glad you were able to provide some perspective on what's going on.
I want to thank everyone who's working very hard, and I think there's a lot of hard work going on, Chris, in the community. So I just think don't give up, but don't stop working. We just all have to keep working. Thanks.
Okay. Thank you, Senator.
All of you. You guys are doing a great job.
Thank you very much.
Bye-bye.
All right.
And
Well,
those
there you go.
shelters that Senator Terlaje was referring to, the Ali Shelter 1 and 2, Sanctuary Incorporated, and Guma San Jose, Public Health early on announced that those following shelters are open and will continue to provide services to their clients. Also, earlier today we had Major Tom Stambaugh. Did I say it right?